I'm Junior Clinical Fellow in Salford Royal Hospital here in Manchester, United Kingdom. And on behalf of the SIGAf Radiology Group, we'll be taking Dr. Adebajo and I will be taking this session on just shedding some light on pathway to radiology training. Dr. Adebajo is an ST2. For those that may not be familiar with those terminologies, so it's like in the second year of radiology training in the UK. We'll shed some light on that as we go through the event. So I'll start and then you'll continue. All right. All right. So just as a brief overview, the training itself is 5 years. So you heard me say ST1, ST2, that's just first, second, third, so up to ST5. And for those that will want to do interventional radiology, then you have an extra year of training, which means you'll be like an ST6. And the most popular route of entering the training is entering through the ST1 pathway from the very beginning, as a lot of people may not have some radiology experience to enter at a higher level. But you can also enter at the ST3 level. We'll touch on that very briefly. Um, Applications generally is a national recruitment, so you apply through the Oriel platform. So it's not the jobs you see on tracks for those that may have been looking for, because sometimes these terminologies may be quite confusing. Sometimes you see ST1, ST2 application, but if it's through track job, then it's probably not, or it is not a training job. The training jobs are usually done in nationally and at strict timelines. So just an idea of the competition ratio getting into ST1 in 2023, there were 3,068 applications for just 350 posts. These statistics are available, and I'll show you some links in my references. If you just Google it, actually, from the Health Education England website, you can get all of this information. Um, Going when we go through the steps, actually, you shouldn't be flustered with this competition ratio when we break it down. This year, I think it was about 4,000 applications actually. So competition ratio may have risen to like maybe 11 is to 1. So for every one job, 11 people are fighting for it with you. And the application will have its person specifications. For ST1, it's not really that complicated. I mean, most people that would apply don't even have radiology experience. So what will usually count against you in person specifications most times is if you do have more than 18 months radiology experience outside your foundation training, which is like the first 2 years of your training. Um, then you are too overqualified to apply at an ST1 level. But that's something that um, hardly counts against people, except those that are already like resident doctors from other countries. Um, you also need to sign and upload a CREST form when you're applying. I know a lot of people should have an idea what the CREST form is. It's a certificate of readiness to enter specialty training. Basically, it's just a form you sign with a consultant in the UK that you've worked with. It doesn't even have to be in the UK, even in Nigeria. A consultant you've worked in for at least 3 months, they sign that you have competencies. And in this 2024, they actually shortened the form. They actually shortened the form a lot. So it was very easy to get it signed. It's not as bulky as it was before. And if you are going at an ST3 level, there's something called the Alternative Certificate for Clinical Radiology. if I want to equate that to surgical training, for instance, it's going to be, the certificate of higher surgical skill that you sign to enter ST3 if you didn't do core surgical training. This will kind of be like, if you think of this certificate that way, that's what I can equate it to. 'Cause I know a lot of people here are surgically inclined. So this diagram I've just used to summarize what the journey entails and the components, and this is what we'll be going through. Um, it involves the MSRE exams, your portfolio, the interview, and I've used these colors deliberately actually because um
Moti, have you
yeah.
changed the slide? I don't think it's
Yes.
changed.
Oh,
Yeah.
is it changed now?
No, not for me though. I don't know if it's anybody with similar
Let
comment
me
on.
see. It's showing on my own screen. It's showing the slides with
Yeah, it's changed
the
now.
pie
It's changed
charts
now.
and
It's changed now.
oh, okay. All right, so I'll continue then. Yeah, so as I was saying, this just summarizes the journey, um, splitting it into MSRA, portfolio, interview, and I'll explain later why I've put these percentages with them. MSRA being 20%, portfolio 30, and the interview 50%. And these colors I've used, I'll also explain why I put MSRA in red, basically. So the MSRA is called Multi-Specialty Recruitment Assessment. I know a lot of people would know about this exam, and I've said tagged it here like kind of the rate limiting step for the ST1 applications. Now the reason I'm saying this is if you make your applications, for you to get invited to put the portfolio that you've been working on throughout the year and then do an interview, you need a certain score from your MSRA exams to even get through to that step. So it's sometimes it can be a very it can be quite challenging because you may have put in so much effort, put in so much work, and then you get a score that doesn't get invited for the exams. Over the years, because of the increased competition, the cutoff that they accept to invite you to put in your portfolio and to do an interview has been on the rise. So, for instance, I would say like 2 years ago, it was like 519, 520 something. And then last year, it was like 539, the total score, the minimum score that they invited. And this last year, it was like 549. So I see you can see where I'm going with it. It's like it's increasing by at least 20 every year. So if you need to have a target for your MSRA, just the highest that you can imagine, honestly, is a good target because you need to look at the trend and know what exactly you should aim for. So it's divided into a clinical part, which comprises of 97 questions in 75 minutes, and a professional dilemma part, which is like the SJTs, situational judgment test that involves 50 questions in 95 minutes. I won't. The official MSRA websites are also available, and you can actually like see how exactly it's broken down in terms of the structure. But the clinical is just every question has 1 mark, and then the situational judgment test. There is really no right or wrong. It's more like a scale, and then they assign marks to how you were able to arrange your answers in the right scale. Um, Eventually your score is scaled, everyone's score is scaled to an average and divided into bands. So in order to say you've passed the exam, and I'm using that in quotation marks, you must have had at least a band 2 in each part, which is like 201 and above. um I mean, that means you can at least be invited for any specialties interview. But each specialty will now have their own cutoff for that year and determine like who exactly they are going to invite. In terms of preparation for these MSRA exams, there are question banks available, just like even the PLAB exams that we wrote. There are banks available. There are some popular banks like Pass Medicine. Personally, that was what I used, especially for the clinical aspect. There are practice papers, official practice papers, and some books, especially for the SJT part, that's the professional dilemma part, which is actually the very tricky part of the exam. There are this UK Foundation Program practice papers online. There are, if you just Google it, you're going to see some of them. Even the MSRA on their website also have their own practice papers, and then there are some books that can actually give you like a very fundamental understanding of the way to approach some of these ethical questions. And I think if those working in the NHS too may also give you some insight into it, but that shouldn't discourage anyone because I know a lot of people that wrote these exams directly from Nigeria and still got very good scores, or directly from other African countries, not just Nigeria. These I put these two books here because these ones helped me to just have a very broad idea of the SJTs and what the examiners may expect. I'm not like saying this is all you need to pass it. I'm just saying these books help me if you need any reference to be able to read about the SJTs. So that's the MSRE, and I'll
Yeah,
go
Moti,
back to
just to,
okay, yeah,
I think we're still not seeing your slides, but I just do want to stop you because we didn't see
okay,
the question banks and all. Are you presenting on
okay.
like a, the
PowerPoint.
presentation view? No, I think when you go to the
Mm,
presentation view, we just lose you and we don't see the can. So if you just go to
okay,
the
I won't
page,
use that
see the
anymore.
background.
Yeah. So you are following
Yes,
it now, right?
yeah, yeah, yeah. There are some
Okay.
questions in the chat box.
Okay.
Do you want to answer them now,
Yeah,
or
I can.
so? Someone was asking about resources for. I'm assuming the MSRP exam. Um, so I
Okay,
think the
so
question banks and resources.
yeah, so I talked about one. I can put them on the chart and
Yeah, I think I can type. I'll
yeah,
just
so
type the ones I can
past
remember.
medicine was actually very useful, especially for the clinical part. In terms of the SJT, let me go back to show. So these, I don't know if you can see these two books, the Oxford situational judgment test. So that's the one most of the medical students use here to prepare for their final exams. Although I think they've removed that actually from their final exams, but this is one book that they use, and then they succeed in your GPST. So the GP trainees use this also for their exams, and these books were very useful. The other banks too. There's the Samsung. It's something that we know from PLAB also does these MSRA exam banks. There are other popular ones too, but I think you, I can't really say there is one that is um, best to use or better than the others. But I think to build your clinical knowledge, past medicine was really helpful in terms of building your clinical knowledge. However, the questions themselves that come in the exam, they look quite, you would actually be surprised. You would think they look very easy compared to what you may have seen in past medicine. And so I think for me personally, Samsung kind of presented their Samsung question banks look very similar to the exam in terms of the structure. So that also like this gives you a snapshot remembrance of some questions. But you need to basically just decide on which bank or which style is more helpful for you. And then in terms of the preparation for the exam, I mean, there's no you can't start too early, I would say, but I think it's also a very volatile. It's quite a volatile knowledge, to be honest. So even if you start early, I think most of your preparation will still be towards around October, November, December before the exams in January. um Before we finish this session, I'll give like the timeline that we used for this year's recruitment. So it changes, but it gives a rough idea of the timelines for the recruitment from your application to the exams to the interview. I'll go through that. I don't know if there are any other questions that I've not answered. Yeah, yes, e-medical. Yeah, thank you. So those are like examples of some question banks. So like I said, I can't really say one is better than the other, but it's just my own personal experience.
I think
Um,
from experience, most of my colleagues also, most people tend to use a bit at least two question banks.
yeah,
Generally, most people choose pass medicine because of the explanations, and you can use it to build clinical knowledge. Then use another one to supplement.
mm,
So at least minimum, or minimum, not tautology, minimum, you should have at least two question banks, I would say, and start early. Um, Especially for the SGT, because it's quite an annoying exam and it's just practice, isn't it?
mhm.
But with two question banks, most times you should be fine. The annoying bit is, um, I think we'll get to that in the concluding part. But MSRA, as annoying as it is still a rate limiting step. If you don't pass it,
Yeah,
you don't move further. So
yeah.
yeah.
Thank you. Yeah. So we'll get back to the MSR eventually. I'll go back to that my chart, the components, and we'll explain better. But let me just move on to the portfolio. The portfolio is what most of us that are looking to get a job next year should be actively working on now, which is why we've tried to make this program early enough in a year. And you see reasons why this has to be as early as you can. So it's divided into 7 domains with a maximum score of 45. Um, I can go to the official site to show you like the breakdown of these domains, but I think, to be fair, like, my advice will be you need to go to and see the domains themselves, um each part of it, make give have like a spreadsheet now, or however you think you can have a visual representation of it, and know the things that you probably have at the moment, know the things you need, and know the things you need to work for. So I'll break each one down and suggest ways that you can achieve them. But I'm just saying that it still depends a lot on you and your planning in order to actually get a good score in this portfolio. So the first domain is the commitment to specialty. Now, to get the maximum points here, which is like 10 points, um, you need I think I should just go to the, let me see, I should be able to have it opened as a tab.
I copied the link on the chat box in case
Ah,
anybody
yes,
wants to check it.
yes, let me just see. Sorry, just give me a second. I think if everyone can you see my web screen at the moment?
Yes.
Okay, so let me just use this to, because I think if you see it, then you can understand better. So the first domain is the commitment to specialty, and My advice is be realistic about your portfolio, but aim for the highest that you can get. Like you can actually max out the portfolio. In this one, it says multiple significant exposures to the work of a clinical radiology department. So for this year and last year, they've actually like made this part a bit easier to achieve. So in the past, you need to have a taster week in two different settings. In other words, let's say you had a taster week in the tertiary setting, you need to have another taster week in the DGH. For those of you that may not be clear on what a tester week is, it's just like a going to another department to observe how things are done for the sake of radiology, at least 3 days. So at least 3 days you join a department and do all of the activities. Now, this last year and the year before actually, but it was not as clear as it was this year. You can actually do everything within your hospital as long as your hospital has a radiology department. And how you can do it is you can do a tester week for the 3 days at least and get it signed off as one evidence. And then you can do another significant exposure. They've given other options. So other options include attending MDTs. Now, these MDTs you're attending should be outside your tester week setting. So within your tester week, you may have attended MDTs, obviously, if you are following them for the activities. But if you attend other MDTs outside that tester week, or you attend radiology based lists like interventional radiology lists, don't limit yourself. Any radiology related list, because for me, if you look at this list, you won't see nuclear medicine. I actually went to our nuclear medicine department in my hospital and attended some of their lists, and it still got accepted. So the fact that they just said one-stop breast clinic or interventional, that's not like all. They are just giving you examples, but it must be radiology related. So if you can attend any of those lists, and in your evidence, make sure you have like a combination of these. So you must have 3 episodes or more. So let's say you have two nuclear medicine lists or two breast clinic lists and one interventional radiology list, or two interventional radiology and at least one of another. So it should be combined and then it should be signed by your clinical supervisor or whoever is organizing the tester week, which should usually be a consultant. It's better for your evidences to be signed by a consultant radiologist that's working in those departments. So this is something that you can actually reasonably achieve your 10 points before the application time reach. It's very achievable. The next one, if it's not clear, just let me know in the chat box. I'll be checking the chat box, whatever questions you may have in the domains. The second domain is leadership and management. And the maximum score here goes for holding a national level leadership or managerial role involving radiology. That's 7 points. And then if you have a national leadership outside radiology, that's 5 points. And it just basically goes down the list. You can go through the list and see what that entails. But what you should know here is whatever leadership experience that you are using, it has to be a minimum period of 6 months, which is why I said that now is not too early. So if you want to get your maximum point here, you should already be in a leadership role, is what I'm saying. Um, Usually, the evidences should be dated before the last day of your application. So, like if you are targeting 6 months until the last days, will usually be like November. Is it November 1st or December 1st now? Not even sure. 26th. I'll show you the timelines. I can't remember the exact dates, but make sure that you would have had 6 months before that end date, and not the time of the interview or not the time that the MSRE exams are written. You should be very disciplined about the timeline. and the evidence also will just be letter from your organization. Usually, that's actually going to count for this. So the opportunities here are there are organizations that are into this. We have some even radiology specific organizations. Um, SIGAf, we also have our radiology subgroup. We have RIGAF too, which Radiology Interest Group of Africa. They are doing very good work there, and there are also opportunities there. There's also the UK RST actually. That's a very big group, and I think at the moment they are even trying to recruit people there to. I think they need like a social media lead and something. If anyone is interested, really, it's something that you can just. I'll drop my email. You can email me, and I can send you like the application for them. But don't limit yourself. Try to start something now that will count towards the time that you actually need it. Let me see if there's any questions on that. Okay. So I'm saying, please explain what else can be quoted as significant exposure apart from tester week. Okay, I would go through that. I, I tried to explain that, but I'll go through it again. Significant exposure. So a tester week, which is you take 3 days out, at least 3 days out, to be in that department and be involved in the activities of that department, and you get it signed. That's a tester week. Another significant exposure. So outside your tester week, you can do this randomly in your own time. You don't need to do everything at once. You can decide to, if your center has interventional radiology, you can decide to go and attend that list. For a fluoroscopy list too, you can go and attend a fluoroscopy list. Ultrasound list, go and attend ultrasound list. Breast stop, one stop clinics. For me, I attended our nuclear medicine department list. So what you need to do is make sure you have at least 3 episodes of this in combination. So don't just attend 3 interventional radiology lists and that's it. Try to mix it up with something else. So if you can get at least 3 of that outside your tester week. In fact, if you don't have any of these services, just the MDTs, even the MDTs of your radiology department, you can go to the MDTs outside the tester week date. So the dates should not clash. If you go for MDTs and let's say attend another list, so 2 MDTs and one interventional radiology list, that will still count as your maximum. I don't know if that's clear now, Mutas. Okay, I'll just go on. Oh yeah, all right. I'll just go on now. Okay, so for that's about the leadership, and then you've got teaching and training. This one too is something that is very achievable in terms of getting your maximum points. The first one is a teaching program at a national level. Second one is at a local or regional level, and the third one is just evidence of providing an organized teaching or training. So just maybe one-off teachings or something like that. Now, the timeline for this is whatever teaching program you are going to do should have run for at least 3 months in total. And again, this is why I said whatever you're doing, you need to make sure it starts early enough. You must have an evidence saying that you are an organizer, and then make sure you are in the habit of collecting feedbacks. So your feedback should have been like reviewed by someone else, usually the consultant that would sign this evidence, and they are happy with that feedback. So once you have all of these in place, you can actually get the maximum points. So I mean, with organizations, I mean, I will refer a lot to organizations that at least are able to do stuff like this. The RIGAF, like I talked about, Radiology Training of Africa, try to organize teaching programs like this. Even SIGAf Radiology too, we can organize teaching programs like this. But you need to really show interest, because you need to be the one to, like, you need to be the organizer basically of this, and you need to have it run for at least 3 months. So you have to, like, be quite proactive about this. Even if you can't achieve, I mean, the maximum points, if you have any teaching program in your trust wherever you work, so in a single hospital, that will count already as 4 points. So both a regional and a local one will still count as 4 points. So a lot of people here at least are able to get very decent scores. So even if you are not able to do an international or national one, even if you do a local one, but it must have run for at least 3 months, you will have feedback that should have been reviewed by a consultant, and then you should also have a certificate signed up for it. That should still get you very decent points in this teaching part. And then the fourth domain is the formal teaching qualifications. Now this part is it's one tricky part of the portfolio to max out. I mean, the reason is you need to hold a formal master's level teaching qualification or above. So master's or PhD in teaching, maybe in education or something, to get 5 points. I mean, if you are not already in a master's program or you've not done one before, that means 5 points. You're not getting the maximum point here. So that's why I said these are not parts that are directly within your control. And I think if you want to channel in your energy on various parts, I won't advise you to go start a master's now just because you want to get 5 points here, against this coming year's application. Um, so something that a lot of people actually do, if you can do a PG set also, that gives you 4 points, and I think those are kind of easier to do because you can do them at your pace and all of that. But a lot of people in these parts end with at least 2 points. Now there are teaching courses, very popular teaching courses that you can use to achieve that. So for me, for instance, I use train the healthcare trainer. Um, it's on Future Learn, and it's an NHS England course. Let me just type it. Train the healthcare trainer. And then there's a very popular 2 days program one. I think is it teach the teacher course for doctors. Yes, teach the teacher course for doctors. That one is done. I think you need to. I don't know if there's an option of doing it online. I'm not too sure, but you may have to go to Oxford. There should be an option of doing it online. It's a 2 day teaching program, and that counts too for those 2 points. Thank you for putting it in the chat. Yeah. So a lot of people just at least land on that, but don't make sure you get 2 points. You can easily do those courses and get your 2 points in minimum. Um, Audits and quality improvement. Now, this one too may look a bit intimidating, but it's very possible to get your maximum points. So to get a maximum point, it says I have led 2 or more audits or quality improvement projects relating to radiology, which can be shown to have resulted in change practice. Now, what that means is whichever department you are working. So I'll give an example of myself. I was working in general surgery at the time when I was working on this part of the portfolio. As long as your audit has a significant radiology component to it, it has imaging component to it, it's still going to get accepted in this part. So don't limit yourself to saying, oh, I don't know any radiologists. I've not done my tester week yet, so I don't have a connection with them. in your department that you are in, whichever department, I don't think there's any branch of medicine that does not involve imaging in one form or the other. If you can find something simple and achievable to audit within this time, you'll still get your maximum points there. So I'll just give an example. I did an audit on the use of CT scans in diagnosis of acute pancreatitis. There's this not to go into the technicalities, but there are guidelines about the timing of doing a CT scan in acute pancreatitis. So I just audited, the department to see if we were complying with those guidelines, and that work actually gave me a lot of points, not only in this domain but in other domains, and got accepted even in this part. Um, so whichever department you are in, just make sure that you do something, but have it at the back of your mind that you should have some imaging components to it. So you need to do two of that, and you need to be the lead. Now, something that you can also do here is, which I would advise, is you need to also be willing to work with other people. Um, Sorry, I'm just looking at the chat box. It says evidence from participating in SIGAf are then regarded as national, international. Yes, they are regarded as international actually, but they hardly ever separate national, international um, in most of this evidence. Usually, national will be maximum points. So, but it's regarded as international. And then it's PG diploma in education from National University in Nigeria. I actually think it should be. What do you think, Dr.
Yeah, it should be
Adebayo? Yeah, it
if you
should
have
be.
certificate
That's
and you
not,
can back
yeah,
it up.
definitely,
Should be.
definitely, and that's
Um,
some good points.
about audit. Just one before I forget, one thing I would say is
Yeah.
because we've talked about tester weeks,
Mm.
advisable to do your tester week a bit early. Two things. One, if you leave it late, you'll be competing with other people who are trying to get dates, and there's just a number of people the department accepts at a particular time. Number two is that most of the consultants and registrars are very nice and approachable. Radiologists are that chilled. So if you tell them that, oh, I need audits, you get at least three. And they are not really expecting you to be the lead. But if you say you want to be the lead, they'll just put your name there as lead. They will help you in the audit also. So doing your tester week early and speaking to them, you get easy radiology audits you can easily complete
Yeah.
um, when you do one. So tester week, if you get one arranged quite early enough, you can take quite a lot and you get lots of advice and stuff from it.
And I also think if it happens that eventually you are running against time, it's possible to also collaborate. So if you work as a co-lead on a project with colleagues, that actually too can get accepted, but it needs to be clearly written in terms of the evidence, because I like the second project I was involved in, I was like a co-lead on that project, and the letter actually said I am a co-lead in that project, not lead, and it got accepted too as my evidence for the audits. So if you have colleagues that are also working towards similar goals, and audits and projects, you can also use that to hasten up your numbers too. Yeah, so I'll go back to, so that's the audits, and then the
I think it's a
academic.
question for your audit. Or
Yeah.
uh, someone is critiquing your audit in the chat group.
Oh, how did you show improvement in practice for your audit on CT scan? Also, I was just giving an example, but yeah, and I'll go into it now. So I did the first cycle and found um, the percentage of our compliance was about 70% or so. And then after that, I presented in clinical governance, presented it to our ED doctors, because I think the gap I saw most of the times was the ED team are the ones that would actually have requested for the scan before the general surgery team. So the general surgery team may be using the guidelines appropriately, but sometimes from the ED they would already have seen a scan being done, and maybe have been at the wrong time. So after we did teachings in the ED, we did presented in the clinical governor in general surgery, and then we audited it for another. I forgot how many months I did it. I think it was like another month or two, and then there was an improvement in the number, so it went up to like 90 something percent compliance in terms of the timing of our CT scans. So that was how I was able to show some improvements in the practice. Is there any other question? Are audits done outside the UK accepted? Hmm. I've not. I'm not too sure. I don't see a reason why it shouldn't be, but I've not really also seen people that submitted the ones they did from Nigeria. So most people tend to just come here, and audits are quite easy to achieve in a very short time, to be honest, when you're here. So most people come and use the ones that they did from here. But I would say if you are stuck, like if you've not been able to do some here, by all means submit it. Submit the audits that you have. Just make sure it follows the guidelines of what they've said. It is signed by a consultant. The consultant writes their registration number, and be very categorical about the wordings and how it should change. So just be clear about what you did, be clear about the fact that you completed 2 cycles, it demonstrated change, and it should be signed by the supervisor. I don't see why they won't accept it. It's just that on a personal note, I don't know people that have submitted those that they did in Nigeria. But I don't think they didn't give any restriction to it. I don't know if Dr. Adebajo has any extra to add there.
I mean, to be safe, it's best to use any audit done in the UK. But
Mm.
if you have evidence and you can prove it follows the guidelines of clinical audits, the basic principles of clinical audits, just submit it. The worst you would do is not submitting it.
Mm-hmm.
So any evidence you have, just submit it. If you can, if you are in a fix and you have to just submit something.
Yeah. Okay. Just go on then. So for the academic achievements, like I said, so some parts you have little or no nothing you can add to it. So to get 5 here, you need a PhD or a master's. I mean, you may not be able to achieve that at this time, but for the 4 points, if you have one peer-reviewed publication relating to radiology as a first author, you already get 4 points. Um, if you have one peer-reviewed publication not relating to radiology, so any peer-reviewed publication at all, and you are the first author, then you can get a 3 points there. But another addition to this is if you are able to have an oral or a poster presentation at a national or international level, so relating to radiology as the first author, then you'll be able to get 3 points. So, just as an example, I was able to get 3 points here because the publications I had were not radiology related, but the audit I talked about, the audit on the pancreatitis, I was able to get it presented at like the Upper GI Surgeons Conference, and that was like a national conference. So that also gave me. So one work can actually give you like points in various domains, is what I'm saying. So if you're doing a work, don't just limit yourself to one domain. You can look at other domains and see how it can help you.
Um, about presentation,
Yeah.
I'm just going to drop a few links. I don't think personally, I wouldn't say I'm involved, but I'm more familiar with the RIGAF guys. They put quite a lot
Mm.
of links and opportunities for presentation, for posters, for avenues to present on stage, poster presentations, and so on. So RIGAF is actually a
So,
very the guys there do quite an amazing job.
yeah.
So there's a lot of support there. If you're really considering radiology, uh, try to join WIGAF and UKRST. I'm going to put a link to join WIGAF here, and
So,
also a link for you Society of Radiologists in Training. So this is just a society for radiologists in training in the UK, usually led by one of the UK radiology trainers, and it's open to clinicians interested in radiology. So they also put up and advertise quite a number of um, avenues for
conferences.
research, conferences, things you can attend. They're on Twitter also, and they're quite active on Twitter, so you should give them a check also. I was trying to post WeGaf here, but I didn't really do that successfully. Maybe at the end I'll find a way to do it. But
Okay.
uh, SRT and WeGaf, it should be fine.
Yeah.
Someone said, does the year of publication matter? For instance, uh, I don't think it does, to be honest.
No.
There's no caveat in their guidance to say you can't submit something you've done a few years ago. It's not written in black and white, so just submit it. I don't think it matters.
So, just as an addition, um, they accept even case reports in peer-reviewed publications. If you're looking for something simple, because some specialties have removed case reports actually from their own peer-reviewed publications. Although, if I would advise there's something I'm working on to get presented, I would advise, because these things they change it year by year, and if they're going to change something there, the easy thing to change is just to remove case reports from it, and then that already makes disrupts a lot of people. Um, but for now, they still accept that. So if your work has been accepted for publication but it has not been published and you have the evidence that it's been accepted already for the publication, you can still use it as your evidence. That's if that happened. So you've not actually published it before the deadline, but it has gotten accepted. They can actually you can still submit that kind of work, and it should get accepted according to their guidelines actually. And then the last one, the last domain, the seventh domain, is prizes and awards. So the maximum point here, if you get a prize awarded by a recognized radiology institution, specialist society, or at a national or international level meeting, or a distinction in final year of medical school. So any of these can count for 6 points. So those conferences that we're talking about, those events that we're talking about where you get your work presented, if you're able to get the poster presentations or oral presentations and get even a prize in some of those events, that itself can count as a prize or an award. And whatever award you have, um, I would say just submit it still. The worst thing you can do for yourself, if you have anything that you think can count for an evidence or count for a domain, is to not submit it. Um, because in terms of my own story here, I had submitted two awards that I had actually, which, to be fair, like, it wasn't. I didn't think it was going to get accepted. Like, I didn't. because it wasn't a conventional, oh, I did a poster and I got an award for the poster, or an oral presentation, or a distinction in my final year of medical school. It was an award for something else, but I still submitted it and it got accepted in the highest domain actually. So whatever awards, so you need to think deep. Whatever awards that you think you have already, still have them in your arsenal. Don't just discard them. And then these links that Dr. Adebajo has talked about, those conferences, when you present those papers, you can also get some awards from there, some prizes there that will still count. Yeah, I don't know if you have any more opportunities for these prizes, Dr. Adebajo.
I was on mute there. Um, there's quite a number of conferences, quite a lot to be honest. Um, but
Mm-hmm.
the best place to get information about most of them, I would say, is Society of Radiologists in Training. Their Twitter page
Yeah.
posts early enough about conferences you can attend. That's all the British societies from BSSR, BIR, all of them. And SIGAf also does a lot with UKRST. So it's difficult to find out everything, but if you follow some of the key ones, then you will get knowledge. Another thing is to have the papers ready to present, anyways.
Mm.
And don't forget, there's also something there about medical school. Any medical school awards is fine.
Mm.
If you can, you don't have to present a massive paper. You can do it. Some of them you just need to present an interesting case. You can go to Taster Week, sit with one of the consultants, see an interesting case, try and follow it up when you get to the ward as clinician. Speak to the consultant and say, "Oh, I would like to write this up and present it as an interesting case for this meeting." So everybody's happy for you to go ahead, and they might even supervise you and say it. That's why I keep saying Taster Week is one of the first things you should aim to do, because the amount of information you get even from attending the Taster Week is quite a lot. In Taster Weeks also aim to meet the registrars, especially year ones and year two registrars. They will know what you do and how to help. So it does not have to be research, it does not have to be a big establishment. You can get to AIDS research and be interesting case presented somewhere in any of these radiology meetings. So you don't have to look too far or limit yourself. Most of these conferences, um, they accept anything. So just submit and see what happens.
Yeah. Federal Scholarship Bursary Award. Oh, would
Um,
that be accepted?
I don't think, because I during my year 2 years ago I
Yeah.
tried this. It didn't work. So
Yeah.
there categorically it's not going to work.
Yeah. Okay. So that's the those are the domains for the portfolio building. Um, let's go back to the slides. I mean, we would answer more questions as they arise, but let me just go on. We're almost done now, actually. And then the last part is interview. I won't talk much on the interview. The reason is, I mean, that's a whole like journey and itself, and usually, I mean, when you've scaled through to get there, also you actually get a lot of avenues and platforms for support for it. But what I can say is, it's in two parts. There are two stations broadly, 10 minutes each. It's on a virtual platform. Um, so the first part, so over the years they had followed like a certain, I would say, certain pattern in terms of the stations, but this year like a week to the interview, they actually emailed us and said they were going to make some changes to it. And so one thing I can say is always have an open mind that anything can happen, anything can change, but preparation and practice will still be adequate even to cope with some of these changes. So this year we had what we call prioritization of clinical scenario and specialty skills station. The prioritization of clinical scenario, they just give you like clinical radiology cases, like clinical cases, everyday cases that you see on the ward in whatever specialty you're in. And but they just ask you as a radiologist, how would you prioritize, those cases? Which one do you think is most urgent? Just in order of importance. I think the most important thing they want to see there is just your clinical reasoning and how you're able to justify your prioritization. And then the specialty skills is still like broadly what everyone may have known, just testing different aspects of, not technical radiology bits, but things that will connect radiology. So they can ask you things about teamwork, they can ask you things about communication. It's just a very long bank of stuff. If you want to get an idea of the kind of questions that you can see in the interview, Radiology Cafe actually have like a long list of possible questions in the interview. If you just go to Radiology Cafe, you at least for now you can just see them and have an idea, because the other resources you may have to like pay to be able to assess the kind of questions that you see. But Research Cafe just have like a full outline of list of questions that are just there. Although the answers are not there, but at least you have an idea of the questions. Um, so in terms of the recruitment timelines, so I'm just using an example of this last one that just happened. The applications period was from 10 a.m. on the 26th of October to 4 p.m. 23rd of November. So this means that your evidences should try to achieve them before that 23rd of November. So your evidences should have been signed. The dates on them should match with this period. Um, and then after you submit it, and that's where you use the Oreo platform, and that's where you upload your CREST form. And at some point in December, this year was 19th of December, they invite you to take the MSRA exams. And the MSI exams, you basically have to log in and just choose a date. So that ranged this year between 4th and 16th of January. And after the MSI exams, now this is why we said MSRA is like the rate limiting step. You would only go ahead to evidence verification upload if you get the desired cutoff in the MSI exam. So for some people, the journey may end at this point of the MSI exams and you won't proceed further. But if you get the cutoff, you are now invited to upload your all this portfolio we've talked about, the evidence, and that happened between 13th to 26th of February. And from there, you get invited to the interview, and the actual interview itself, and then the offers and all of that. So, in conclusion, I would say it's a journey, but the key thing is you need to plan and you need to prepare early and be connected to other applicants. Broadly, what I mean by this is you see the opportunities that Dr. Adebajo has also given. Those in RIGAF, those in UKRST, this subgroup, radiology subgroup of SIGAf, be connected to platforms that will actually like give you these opportunities as they arise, because you should, if you do it in isolation, you probably be quite deficient, and by the time you realize it, it may be too late for that cycle. So try and be connected, try and know what exactly is going on at every time. And this, I mean, all I've talked about can be found in these links here. I didn't talk about the entering through ST3 pathway. I didn't officially talk about it. I don't know if Dr. Adebajo will just throw some light there, but I've made my focus the ST1 pathway for now, and then we can go from there.
The ST3, just to the ST3 pathway. I think they started it a couple of years ago, last year or 2 years ago. I can't remember now. So there are usually a few training posts available nationally at ST3 level. The main requirement is one, you should be in training already somewhere or working as a radiology registrar somewhere. Two, you should have passed at least first part of the FRCR exam, because to pass through ST1, you must, to become ST2, you must pass the first part. So you cannot be ST3 without passing the first part. And I think the last one is you must have gotten signed that you're competent enough to work as ST3 by a radiology consultant, I think preferably in the UK. So it's more focused towards registrars or clinicians who are in training in other parts of the country, or people that are not in training and are currently in the UK. So the more conventional pathway is ST1. ST3 is just an additional pathway for other people to get into training. Fewer numbers must be said, and it's a bit more difficult. But on the link that Moti posted, I'm sure you'll be able to read about the eligibility criteria. I can try and post it also. I think I have it open here. Open here.
Yeah, I can post it here too.
You have it here.
Yeah, to have it on my slides. I can just post it. For some weird reason.
So just to talk about your last slide, I want to comment on the part where you said connect with the part. Yeah, I think that's things I learned from my own journey.
Sorry, I can't hear you clearly.
Can you hear me now?
Yes.
Yeah, I think the most important one first is MSRA, because you can have the best portfolio, but you don't pass MSRA, and it's all wasted, unfortunately, which is quite sad. So I think that's, I would say, is the most important step in the journey, to be honest. MSRA. Another one is connecting other applicants. It's quite important. UKRST and SIGAf, I know they have WhatsApp subgroups where people meet to discuss and practice MSRA questions when the time reaches. So if that kind of thing is your, if you like stuff like that and you do well in groups, you can join them. And they give lots of information about how to build your portfolio. Any questions you have, you always find a training there that can answer your questions. The portfolio is it can look very cumbersome and looks like you need quite a lot, but it's very doable. And most people will always be around the same ballpark. You rarely see anybody that has a PhD in education. Most people are around the same thing, but there are a few stuff you can do. Get tester week done early, and you can always get advice from trainees and consultants when you do your tester week on how to go about it, because everybody's journey is different. The way I did mine is different from the way Moti did this, and you always see someone there that might be similar to you and be able to advise you properly. There's just a question that what are the options for people in training or practicing radiology in Africa aside NTI? So I think that's, if you want to look at the ST3 application route, something you can consider if you have a pattern of the FRCR. Just look at I know this presentation we've not really focused on ST3, we're focusing more on ST1, but it's something I know a few people have done and been successful with. So I think Moti just posted a link above your question. Just check it and see the testing specification. That's something that you can consider, I would say.
So there's even the in the ST3 one, there's actually like the self-assessment for it. Let me post the exact link that will take you. Although the first one I've posted should, if you check from there, you should be able to go to the self-assessment. So this portfolio that we've just talked about, there is also the one specifically that should give you like the self-assessment guide for ST3. And then same approach, basically same principle. You have to first know what you're aiming for. So you need to go through it now and know what you have and know what you're um, aiming for. I would say would appreciate a
Yeah,
subsequent session on that. Quite a few of us fall in that category.
I don't know if the radiology subgroup of SIGAf organized one, but I know
Mm.
UKRST, they did one last year. They might do one this year. I know the guys in the graph also might do one this year. So if you join those groups, you might get an idea on how to UKRST. I know they did one last year. I actually saw that, to be honest. But I'll leave it to Moti to decide if he wants to organize a one for ST3, like SIGAF
Would,
subgroup.
would communicate. I think on that one, we'll most likely do it with our colleagues too in RIGAF. May collaborate on like trying to put that one out, but we'll definitely keep everyone updated, when we're going to do that program. But because it will be, I'm of the opinion that it will usually be more effective coming from someone that would have done it and gotten it this year. Um, because there may have been some changes that they may have made, and it's something that is relatively new. Like Dr. Adebajo said, it's just within the last 2 or 3 years that they opened up that pathway to enter that level. So this, I put back this slide of the journey components because why we said MSRA is the rate limiting step and gets you to the door. In the grand scheme of things, it's just 20% of your total score. So your aim, as much as possible, is get a good score that gets you to the door. But don't be too flustered if your score is not like one of the highest, because in the grand scheme of things that makes 20% of it, and by the time they scale those scores, the truth is even someone with 600 and something and you with probably 560, it's not going to be that much different when they scale it to 20%. So don't be discouraged, just be focused on getting into the door. And then the portfolio itself now makes up 30% of the final score. So, which means the interview is actually very important. The interview is 50%, that's half of everything. So, no matter what you may be feeling, you may not have had a good MSRI score, your portfolio may not have been as optimal as you want it to be. If you get an invite to the interview, give it your best. Okay, give it your best. Do it like that's all it depends on, because most times that actually tends to boost a lot of people and they still rank very well even with not so good scores in the MSI and the portfolio. So that's why I did this slide and want to just emphasize on it again. Are there any more questions that we have not addressed? I think it's a good time to. Okay. Okay. um so there's a I've just put the feedback on the chat here just so people can actively fill the feedback. It will also be sent to you as an email after this program ends. So do well to still, if you filled it now already, you don't have to fill it from the email. But please, we do appreciate this feedback, and it's very useful subsequently. Dr. Adebajo, I don't know if there's anything you'd like to add.
No, I think it's good to be thinking about it early because it's quite a journey, uh, but it's very doable. Um, I think we've covered most. It's just the quick whistle stop, but it's longer than a whistle stop to be honest. But it's just to give an overview and an idea of how the process is, and I think you've done quite a good job. Nothing more from me, I would say.
So, for those that would want to also join this group, if you just go through the website sigaf.org and try to join, you'll see the link for the WhatsApp group there. And Dr. Alibaja has kindly posted the one to join RIGAF and UKRST. You need to join first, apply through um, Facebook. You need to be accepted through Facebook there, and they also have a WhatsApp group because I'm part of that group too. Just need to um, once someone, I mean, you can send me a message. I can ask, for you to be added to the WhatsApp group if you're interested. Um, yeah. So thank you everyone for attending. I'm just going to end the session here.